Hi there everybody, this is Dr. Andrew Scanameo. I'm your elder care specialist and I'm reporting to you from Andrew MD, where our mission as always is to help mom and dad live long and better. Today we have a very important and timely healthcare topic, and that's the use of medications, the top 10 medications that should not be used in older people. The first category are the narcotics, or medications like morphine and hydrocodone. These drugs cause constipation and confusion. They can increase your risk of falls if you're unsteady on your feet. Another medication in the same category is tramadol or Ultram. It should not be used with people with kidney failure or seizures. The second group of medications that should not be used are the antihistamines. These are the drugs like Benadryl, which is found in Tylenol PM. People use it for allergies and for sleeping. These drugs cause confusion, constipation, dry mouth. Benadryl should never be used in an older person. If you have to take an antihistamine for allergies, you can take a newer generation, second generation drug like Claritin. The third group of medications that should not be used is the old antidepressants like Elavil and Pamelor. Elavil is used for sleeping and depression, and Pamelor is used for nerve irritation and neuropathy. Elavil or amitriptyline, they are the drugs that cause constipation, confusion, and dry mouth. There are better alternatives. If you want to sleep better, you should Google the topic sleep hygiene, and there you'll find sleep techniques like going to bed at the same time every night, getting up at the same time every morning, and urinating or emptying your bladder before bed. This will help you sleep. If you're taking the Pamelor for nerve irritation, there are better drugs like Neurontin or gabapentin, a much better choice. The fourth group of medications on the list that should not be used in older people are the water pills. Water pills like hydrochlorothiazide and Lasix are used for swelling of the legs, high blood pressure, and heart failure. HCTZ or hydrochlorothiazide should not be used in an older person, period. If you're taking Lasix for swelling of the legs, you're better off using my triple therapy, which is elevation of legs, low salt diet, and compression hose. If you're taking Lasix for heart failure, you have no choice and you have to continue that, or consult your physician. The fifth group of medications are the blood thinners. The use of blood thinners in patients over 75 brings along with it an increased risk of significant bleeding and hemorrhage. The new medications like Pradaxa, Xarelto, and Eliquis should not be used in patients with kidney failure. Some better alternatives include aspirin and filters, but this advice should be gotten from your doctor. The sixth group of medications that should not be used are the long-acting sedatives. Xanax, Valium, and Klonopin stay in the body for more than 24 hours and can cause significant confusion, falls, and weakness. A better alternative is Ativan. Ativan is shorter acting, but this advice should be gotten from your doctor. The seventh medication on the list today is DIG or digoxin. This medication in older persons can cause an increased risk of death. A better alternative includes the use of calcium channel blockers and beta blockers. The eighth group of medications on the list today are the muscle relaxants like Flexeril and Soma. These drugs can cause significant dry mouth, confusion, and constipation. Because pain in older patients is usually associated with arthritis, trauma, or surgery, these drugs are not indicated. A much better alternative is extra-strength Tylenol. The ninth group of medications on the list today are the long-acting diabetic medications like Glyburide. Glyburide stays in the body for more than 24 hours and can cause critical low blood sugars, resulting in confusion, weakness, and even death. Consult your doctor for the other alternatives. The last group of medications that are dangerous in older people are the chronic use of the anti-inflammatory medications like ibuprofen, Aleve, and Celebrex. These drugs used on a chronic basis can cause bleeding in the GI system, swelling of the extremities, and heart failure. There are better alternatives, including extra-strength Tylenol. This is Dr. Scanameo. Thank you for your attention.